Imagine your body's immune system just mistakenly turning your most sensitive skin into rigid, painful scar tissue.
Right, and it's something that just relentlessly progresses over time.
Exactly. Now imagine the only way to treat it actually makes that skin even thinner and more fragile than it already is. I mean, for millions of women suffering from a condition called vulvar lichen sclerosus, or VLS, this is just their everyday reality.
It is, and it's a devastating reality for so many.
But what if the cure was actually hiding right there in their own body fat?
That's the real breakthrough we're seeing. It is a profound shift in how we think about healing this condition. I mean, we are moving away from the traditional strategy of simply, containing a disease.
Right, like where you apply a cream just to stop an itch or suppress a symptom for a few hours.
Exactly. Instead, we are looking at true regenerative medicine. The goal here is to actually revert that degrading tissue back to its healthy original state and doing it using the body's own raw materials.
Which brings us to the core of our deep dive today. We are exploring the science of autologous fat grafting.
Which is just a medical term for taking a patient's own fat and transferring it to a diseased area.
Right. We're unpacking how this is being used to completely change the landscape of VLS treatment. So our mission today, looking at peer-reviewed clinical studies, plastic surgery guidelines, and new medical device literature, is to understand how this goes from being, well, just a cosmetic procedure.
Which is how, most of us think about fat transfer, right?
Exactly. We're looking at how it becomes this groundbreaking regenerative therapy. We want to know why it works on a cellular level and what this means for you, the listener, and the future of chronic disease management.
So to appreciate the magnitude of this treatment, we first really need to look closely at what these patients are actually enduring day to day.
Yeah, let's establish that. Vulvar lichen sclerosus is this chronic, severely inflammatory skin condition primarily affecting the genital region.
And the clinical data shows this fascinating bimodal distribution, meaning it predominantly strikes two very distinct groups.
Right, prepubertal girls and postmenopausal women.
Yes, and the symptoms, they go far beyond just mild discomfort. These patients experience intense, relentless itching, burning, and just severe pain.
And the physical toll is devastating. Like the research we looked at details these severe anatomical and architectural changes. We are talking about the burying of the clitoris or the shrinking and narrowing of the vaginal opening.
Medically known as the introitus, yeah?
Right. The tissue thickens, it hardens, and effectively scars over, leading to dyspareunia, which makes sexual intercourse incredibly painful or, in a lot of cases, just entirely impossible.
It's life-altering. Plus, anyone dealing with this carries a 2 to 6% lifetime risk of that inflamed tissue developing into vulvar squamous cell carcinoma.
Which is a highly aggressive skin cancer.
It is, which is exactly why the underlying biology of this disease is incredibly important to understand.
So VLS is an immune-mediated condition, right?
Yes. The damage is primarily driven by a specific type of immune cell called Th1 cells. You can basically think of Th1 cells as the body's overzealous border patrol.
Right, so usually their job is to attack foreign invaders, like viruses.
Exactly. But in VLS patients, this border patrol gets totally confused. It starts attacking healthy tissue, creating this massive wave of oxidative stress.
The research also highlighted a specific genetic factor here, something called miR-155.
Ah, yes, miR-155. It's a pro-inflammatory microRNA.
Which basically acts like a genetic switch that gets jammed in the on position, right? Just constantly telling the surrounding tissue to stay inflamed.
That's a great way to put it. And that chronic inflammation leads to the most destructive part of the disease process. It triggers the production of autoantibodies that specifically target a vital protein called ECM1.
Extracellular matrix protein 1.
Right. In a healthy body, ECM1 is essentially the biological scaffolding. It maintains the structure of the skin and it supports the blood vessels that feed it.
So when the immune system destroys that scaffolding, the skin basically loses its blood supply and its structural integrity.
Exactly. That is exactly what causes the thick, rigid scarring and the architectural shrinking you described earlier.
Okay, let's unpack this for a second. Wait, if this is an overactive immune response causing severe structural damage, why isn't standard medicine fixing it? I mean, the current gold standard of care is prescribing these ultra-potent topical corticosteroid creams.
It is. That's the established first line of defense.
But looking at the sources, it sounds like using potent steroids long-term is a bit like trying to put out a fire with a heavy lead fire blanket. I mean, sure, you smother the flames of the inflammation.
But if you leave that heavy blanket sitting on the lawn forever, The grass underneath is going to wither and die anyway.
Right, exactly.
That is the perfect way to visualize it. In dermatology, we actually call that dying grass skin atrophy. The clinical reality is that 50 to 70% of patients only ever achieve a partial response to the steroids.
So the blanket doesn't even cover the entire fire.
No, it doesn't. The remaining simmering inflammation just continues to cause structural damage.
So they are completely trapped, the disease is destroying the tissue, and the treatment is weakening whatever tissue is left.
Precisely. The steroids suppress the immune response, sure, but they actively exacerbate the tissue thinning that VLS patients are already suffering from.
It's a terrible biological catch-22.
It really is. Standard care is strictly focused on managing the crisis, but it does absolutely nothing to rebuild the scaffolding that the immune system burned down.
So, since the tissue is actively atrophying and standard medicine isn't rebuilding it, we have to look for a completely different biological solution. And that brings us to autologous fat grafting.
Also referred to in the medical literature as lipofilling or lipotransfer, yeah.
Right. And for a long time, if you heard about fat transfer, you probably just thought about breast reconstruction or facial volume restoration.
Right, purely cosmetic applications.
But the science has evolved so much. Let's walk through how this works, starting with the procedure itself.
Sure. So it begins with a harvesting phase. A clinician performs a mini liposuction procedure to collect the fat, typically from the patient's abdomen or thighs.
But the crucial step happens next, right? Because you cannot simply inject that raw harvested fat directly into the delicate vulvar tissue.
No, absolutely not. The raw harvest is full of oil, blood, and tumescent fluid from the liposuction process itself.
It has to be refined down to the good stuff.
Exactly. The fat is placed in a centrifuge and spun at high speeds, usually around 3,000 RPM for about 3 minutes.
Wow.
Yeah, and this mechanical spinning separates the heavy fluids from the most biologically valuable components. What you are left with is a highly purified, concentrated tissue graft.
And then they inject it using specially designed, extremely fine cannulas, right? The sources mention things like a 3-millimeter cannula and 14-gauge needles.
Yes, very delicate instruments. This purified fat is meticulously injected into the submucosal and intradermal layers of the vulva.
And when you look at the research, there are really 4 different ways this processed fat fights the disease. First, there's a physical volume increase, which the literature calls the cushion effect.
Right, which makes immediate sense.
Yeah, just by providing mechanical padding, it immediately improves the anatomy and significantly reduces the pain of physical friction. But it's not just a physical cushion, right? It's chemical, too.
Very much so.
So the second mechanism is a massive reduction in local inflammation. Third is tissue regeneration, which includes stopping the scarring and actually building new blood vessels. And fourth, it actually manages to calm down the overactive pain fibers in the region.
And those chemical and regenerative changes, they are entirely driven by the cellular heroes hidden inside that purified fat.
Because it's not just fat cells.
No, it is a huge misconception that fat is just lipid cells storing energy. That purified tissue is actually a rich biological soup known as the stromal vascular fraction, or SVF.
SVF, got it.
And the absolute most important ingredient in that soup are ADSCs, adipose-derived mesenchymal stem cells.
Okay, I want to pause on that term, mesenchymal, because it sounds super intimidating. But really, mesenchymal stem cells are just specialized adult stem cells that have the unique ability to build structural tissues, right? Things like bone, cartilage, and in this case, healthy new skin and blood vessels.
Yes, they build.
Yeah.
But they don't just build, they communicate.
Here's where it gets really interesting. How does belly fat, which, let's be honest, most people just think of as unwanted insulation, how does it actually know how to heal a complex, localized autoimmune disease in a completely different part of the body?
What's fascinating here is the sheer sophistication of cellular crosstalk.
Crosstalk.
Yeah. When you introduce these stem cells into the damaged vulvar tissue, they survey the microscopic environment. They detect the massive inflammation and the oxidative stress that's already there.
So they kind of assess the damage.
Exactly. And in response, these stem cells act like cellular peacekeepers. They begin secreting powerful anti-inflammatory molecules, most notably a cytokine called interleukin-10.
Okay, IL-10.
Right. This interleukin-10 directly targets those overzealous Th1 border patrol cells we mentioned earlier, essentially signaling them to just stand down and stop the attack.
So they are literally turning off the fire at the cellular source rather than just throwing a heavy blanket over it.
Yes. And once the fire is suppressed, the rebuilding finally begins. The stem cells release growth factors that trigger angiogenesis.
Which is the creation of brand new blood vessels.
Exactly. Remember that the body's immune system destroyed that ECM1 scaffolding, which ended up starving the tissue of blood.
Right.
Well, these stem cells bypass that damage and construct a fresh vascular network, bringing oxygen and nutrients back to the starving skin.
It also seems like they tackle the scarring directly. The research points out that these stem cells actively suppress hyperactive fibroblasts,
Yes, the fibroblasts.
which are the builder cells that go into overdrive during trauma and pump out all that thick, rigid scar tissue. By calming those builders down, the stem cells don't just stop the snarring, they can actually start reversing the fibrosis that has already occurred.
Which completely changes the architectural integrity of the tissue, eventually restoring elasticity and softness.
I mean, all of this theory is incredible in a lab. But if you are someone suffering from this condition, the only thing that matters is whether this actually wins the fight in a human body over time.
Of course.
And when we dive into the clinical data, the outcomes are, frankly, astonishing.
Oh.
Like, there's a major 2020 clinical study out of the UK by Almadori and colleagues. They followed 33 patients.
Right, the Almadori study.
They documented massive subjective improvements in itching, burning, and sexual function. But more importantly, the clinicians recorded objective, highly visible improvements in the dermal fibrosis itself. The tissue physically transformed back toward a healthy state.
And that finding is highly consistent across the literature. If you look at a 2015 study by Barrero on 36 treated patients, 94% experienced a complete disappearance of their scratching lesions.
94%, wow.
Yeah. And 75% regained significant tissue elasticity.
And perhaps the most life-changing statistic from that Barrero study, 95% of those patients were able to completely stop using their potent topical corticosteroids routinely.
It breaks the vicious cycle of skin atrophy entirely.
It really does. But, with any chronic lifelong disease, the immediate question is longevity. Does this grafted fat just, melt away after 12 months, forcing the patient back into surgery?
This raises an important question about the durability of regenerative medicine. And a 2023 long-term follow-up study by Kaya and Pierazzini actually provides a definitive answer to that.
Yeah, they tracked patients for up to 11 years post-surgery.
11 years. And even over a decade later, the patient satisfaction rate held strong at 88.7%. The restored vulvar architecture didn't degrade. It remained remarkably stable.
And the most profound detail in that 11-year follow-up was the cancer rate. 0 cases of vulvar squamous cell carcinoma occurred in the treated group. Given the normal 2 to 6% lifetime risk associated with VLS, seeing a 0% occurrence over a decade is a monumental finding. It suggests the tissue didn't just feel better, it was fundamentally healthier on a structural level.
And clinical practice is continuing to iterate on these successes too. It's actually rare to see fat grafting performed in total isolation anymore.
Oh, really?
Yeah. Many leading plastic surgery and regenerative clinics are utilizing combination therapies to maximize the survival of the grafted fat. A common protocol involves combining the fat transfer with PRP, or platelet-rich plasma.
Right. I see PRP mentioned everywhere in the clinical guidelines. It's essentially taking a small sample of the patient's own blood, centrifuging it to isolate the blood platelets, and then mixing it with the fat before injection.
Exactly.
It kind of reminds me of mixing high-grade fertilizer into the soil right before you plant a delicate new tree.
That analogy captures the biology perfectly. Those concentrated platelets are absolutely bursting with growth factors, specifically PDGF and VEGF. When you inject a fat graft, those cells experience a period of shock because they are temporarily disconnected from a blood supply. By mixing in PRP, you bathe the stem cells in growth factors that accelerate their integration.
And dramatically increase the survival rate of the transplanted fat.
Precisely.
And the multidisciplinary approach doesn't stop at the surgical level either. We are seeing trials incorporating dietary interventions like specific oral collagen peptide supplements.
Like the collagen that Pink Beauty mentioned in the literature.
Yes, exactly. The idea is to provide bioactive collagen building blocks from the inside out to further boost mucosal hydration and tissue elasticity following the surgery.
It really highlights a comprehensive, full-body approach to healing. But, for the listener wondering why their own gynecologist hasn't offered this to them yet, we have to address the very real logistical barriers that have kept this therapy out of the mainstream.
Right, because if you have a condition this painful and a treatment with an 88% success rate over a decade, you would expect it to be available in every clinic in the country tomorrow.
You would think so. But the reality is that harvesting fat is a surgical procedure. Historically, it requires specialized training in liposuction.
Which means this incredible treatment has largely been locked behind the doors of specialized plastic surgeons.
Yes.
And the financial barrier is steep. Looking at standard clinical pricing, a treatment involving fat transfer and PRP for lichen sclerosus can cost anywhere from $6,500 in an outpatient setting up to nearly $8,000 if an operating room is required.
It is expensive.
It's a highly specialized service because injecting tiny volumes of fat like less than 25 cubic centimeters into highly sensitive genitalia requires immense precision.
But this is exactly where medical technology is stepping in to solve the bottleneck. The research points to a major innovation that is actively democratizing this procedure.
You're talking about the Cephagen device.
Yes, a medical device called Cephagen, which is based on a patented technology called cephaline.
I was looking into the mechanics of this device, and it
Yeah.
completely changes the surgical requirements.
It does. Cephagen is essentially a sterile, disposable, all-in-one medical kit. It is explicitly designed to empower gynecologists and dermatologists, the doctors actually diagnosing and managing VLS day to day, to harvest this tissue safely in a standard office setting.
Without needing years of complex liposuction training.
Exactly.
The way it works is fascinating. The device uses a specialized microharvesting cannula. So instead of violently suctioning out large chunks of fat like traditional liposuction, this cannula has specially designed microports that basically fluidize the tissue as it collects it.
Right, it mechanically breaks the fat down into microscopic fragments without destroying the delicate walls of the stem cells inside.
And that microfragmentation is vital, right?
Absolutely. It standardizes the harvesting process, ensuring that the doctor consistently extracts a high yield of that stromal vascular fraction we discussed earlier. It makes the entire therapy vastly more accessible and reliable.
Okay, but I want to push back a little here. Making a surgical procedure easy for non-surgeons can sound a bit alarming to some people.
That's a fair concern.
Because the guidelines from the American Society of Plastic Surgeons, as well as foundational studies on fat grafting by researchers like Hayako Soku, explicitly warn that injecting fat is not a risk-free endeavor.
No, it certainly isn't.
They highlight significant complications like hematomas, seromas, or the most concerning one, fat necrosis.
Right, necrosis.
Which is what happens when you inject fat cells and they don't get access to a blood supply fast enough. The cells literally die and calcify into hard, painful lumps under the skin. That sounds like the absolute last thing a VLS patient needs.
If we connect this to the bigger picture of procedural safety, your pushback is completely validated by the literature. While the vulvar procedure is minimally invasive, the technique is unforgiving.
How so?
Well, if a practitioner simply pumps a large volume of fat into a single pocket of tissue, the cells in the center of that pocket will starve, die, and cause necrosis.
So you can't just flood the area and hope the cells figure it out.
No, the placement requires extreme meticulousness. The practitioner has to carefully lay down microdroplets of fat in multiple distinct tissue planes.
Ah, okay.
This ensures that every single grafted stem cell is within a millimeter of an existing blood vessel, which guarantees its survival. And this is precisely why standardized microfragmenting tools like Cephagen are such a critical advancement.
Because it does the fragmenting for them.
Right. By ensuring the fat is already broken down into fluid micro-sized droplets before it even enters the syringe, the device naturally prevents the clumping and pooling that leads to necrosis. It mitigates the exact risks the plastic surgery guidelines warn against.
So what does this all mean? Let's take a step back and look at the sheer scale of the journey we've just mapped out today.
It's quite a journey.
For decades, the medical community has approached this chronic, intensely painful, and frankly intimate condition with a strategy of mere containment. We've asked patients to rely on heavy, skin-thinning steroids that often only mask the symptoms, while the underlying architectural damage quietly marches on.
Just managing the decline.
Exactly, but today, the data shows us a very different reality. By harnessing the regenerative power of your own stem cells, hidden right there in your own adipose tissue, medicine is learning how to literally rebuild the scaffolding of the skin from the inside out.
It's incredible.
For you listening, whether you are directly impacted by autoimmune issues, working in the medical field, or simply fascinated by the bleeding edge of science, this represents a monumental leap forward in women's health. We are talking about utilizing our own biology to bring real hope, restore intimacy, and provide a vastly improved quality of life for a condition that has been suffered in silence for far too long.
It is a profound transition from managing decay to actively promoting restoration. And as we close this analysis, there is one final lingering implication hidden deep in the long-term data that really demands our attention.
What stands out to you?
Well, we established at the beginning that vulvar lichen sclerosus carries a 2 to 6% lifetime risk of developing into malignant squamous cell carcinoma.
Right, the cancer risk.
This cancer risk exists because VLS creates a microenvironment defined by chronic oxidative stress, persistent inflammation, and a destroyed extracellular matrix. That is the exact chaotic environment that allows rogue cancer cells to take root, hide from the immune system, and multiply.
A perfect storm for malignancy.
But when we look at the 11-year follow-up study on patients treated with their own stem cells, the researchers observed 0 cases of cancer.
Wow, not just a reduction.
Not a reduction, 0. So the provocative question this raises for the future of medicine is this: could regenerative therapies like autologous fat grafting eventually prove to be much more than just a powerful treatment for painful symptoms?
That's a huge thought.
Right. By fundamentally repairing a tissue's structural matrix and permanently shutting down that chronic simmering oxidative stress at the cellular level, could our own fat actually become a primary preventative tool against the development of cancer in chronic inflammatory diseases?
Wow. Reprogramming the body's own tissue, not just to heal the pain of the present, but to actively shield against the threats of the future. That is an incredibly powerful thought to leave on. Thank you for joining us on this deep dive. Keep questioning, keep learning, and we'll see you on the next exploration.